Hey, thanks for joining us. We have Michael, who tore up the back of his leg on the car.
Yes, he did.
How'd you do that?
I slammed the door on it. Don't ask me how I did that.
On your own leg?
Yeah.
Oh, man. I could see doing it on someone else's leg, but on your own leg.
Yeah, I know. What was I thinking?
Okay. All right, we'll get started repairing this. So let me have you lay facing down. So, Mike, the reason I made a funny face when we were talking about how long it's been since you cut it, because it's been 15 hours.
Right.
Well, there is kind of a wisdom, but it's not necessarily wise, in medicine that you don't repair wounds if they've been open for longer than 6 hours or so, that you leave them open and wait a while before, because the thought was there's an increased risk of infection. Well, with good irrigation of wounds, we found that you can do it a day later and it's okay. There's good evidence to that point. So if people are watching this video who have heard, oh, you can't close something if it's been open for 6 hours, actually the literature shows that you can. There's good emergency medicine literature that's been done that shows that the infection rate is not higher with the wound you leave, or the one you close compared to the one that you leave open. So we'll go ahead and close this because you actually have fat sticking out of your wound. And you just can't walk around like that. Well, it depends. I guess it depends on what what social group you tend to identify with, but most of us can't just walk around with fat hanging out of our legs. Okay, this one's yours.
Wait, let me see. We can pull one of these around to hook on this thing. The other one can hook.
Cleanser around this.
On there. I won't be able to zoom the line.
So zooming will be done by stepping forward, stepping backward. That's okay. So this is just the, is that stinging at all?
No.
This is the antiseptic. And we will need a fenestrated drape for this.
There's one in that thing.
Okay. So this is going to get on the floor. We don't have a bucket. But here we go. So everybody has their splash shields on. Here we go. We're going to irrigate out the...
Okay.
You feeling that?
Oh, yeah.
There we go. And then, yeah, oh, good. That caught it on the floor pretty well. All right.
That's supposed to sting now, is it?
It does a little. I'm going to give you some injections of some anesthetic. And I have a principle of injecting in the wound. Does that burn? Is that hurting?
Yeah.
Maybe a little bit. And the reason I do that is because you're avoiding some of the pain receptors by injecting in the inside of the wound like that. Whereas if you go through intact skin, you're hitting all of the pain receptors, so it actually hurts less.
So are we going to numb this up?
That's what we're doing now. All right. Are you feeling it at all, Mike?
I'm good now. Are you doing something?
We're giving you shots.
I don't feel it. I don't feel it.
And we're also ordering a tetanus shot for you because I looked and your tetanus shots aren't up to date.
Ooh, okay.
But your insurance will pay for it now.
Man, now I feel it.
Yeah. All right. Now if we're going to get some sterile gloves on and really explore that, that's another essential part of the process is the exploration. Exploration. Am I hurting you?
No.
All right, so yeah, you can see some potentially devitalized tissue there. Actually, it looks pretty good. So this is what we irrigated. And I'm just making sure I don't find something you can actually feel, like a rock. Although you didn't do this on the road, this was just was the bumper? No, the car door.
The bottom corner of the car door.
So,
I couldn't do it again if I wanted to.
So unlikely that anything broke off of the door and got stuck in here.
Yeah, probably not.
But there could have been bits of clothing, maybe, if you're wearing clothes. Do you wear clothes, Mike?
I was when I did this, yeah.
Okay. Well, you know, I just have to ask on everybody.
You never know who you're dealing with.
All right, so we're good. So with a clean wound, even though it's been 15 hours, we irrigated well, we're going to close. We are not going to use antibiotics because the incidence of infection with antibiotics prophylactically is not any less than when you don't, excuse me. So first thing I'm going to do is bisect the wound right in the middle. Not truly bisecting because I'm not cutting anything, but need to get the angle right there. All right. Pull that together. Now, a lot of the videos people watch, they'll see an assistant cut the suture for the doctor. But we don't quite have something that fancy yet.
So you bisect it?
Yeah, put one suture right in the middle to make two roughly equal halves. And then go in and do it again with one of those halves. So we'll put in 3 sutures. I often put in an odd number of sutures because I do it that way.
That's just how you do it, huh?
Yep, that's how I do it. It's my technique. Not everybody's technique, but my technique. A lot of times we'll get people the right comments in our videos that, you know, if they see other techniques from other doctors, they'll write about how they're different, and we have little discussions about the pros and cons of different ways of doing things.
So what's the keywords to look you up? Auburn?
Auburn Medical Group.
Okay.
And that'll get our channel on YouTube. Or if you go to auburnmedicalgroup.com, then you can click on the little YouTube icon at the bottom of the page.
Right.
Or for some people, there's patreon.com/Auburn Medical Group, which that's some extra stuff. That's like behind the scenes and like a video we're putting up next week. Of course, by the time somebody sees this, it'll already be up. I did an injection on somebody's knee, and I actually went in the wrong spot. Pulled back and then put it in the correct spot. But the whole part about putting it in the wrong spot, I cut that part out for the one that goes out to the public. That's just for the people that are paying a little bit to watch the extra stuff.
Yeah.
So we'll put a little bandage on this because it will just ooze a little bit. You can see some oozing from that suture right there. And we will keep a close eye on this. Mike, I'll need you or Lorraine to be looking at this to look for redness spreading around it.
Okay.
Or if you get a fever or if pus comes out of it, we'll have to put you on some antibiotics.
Right.
We'll give you a tetanus shot before you leave today. Thank you for your patience. How you feeling?
I'm feeling great.
You're so good.
Appreciate the fine work. I highly recommend Auburn Medical Group. Was I supposed to say that?
Now, how much am I supposed to pay you for going and cutting your leg to do this?
We'll start with lunch.
We'll start with lunch. We should do that sometime. Hey, thanks for joining us. Mike's a great guy, and I'm sorry this happened to him, but I was really glad to get him on the video because he's cool. Your whole family's cool.
Glad to be here.
Yeah. So thanks for joining us. Hey, if you do want to see those behind-the-scenes videos that we talked about, you can become a member of our patrons or our Patreon. There's a link to click for that. And until next time, Mike, myself, Dr. Mark Vaughan, telling you to stay in good health. Thank you so much. Okay, I'm going to leave you in Ian's kitty.